Hi, I'm Ashley Pins. I'm Patient Care and Wellness Coordinator in our Manchester Clinic, and I'm here today to talk about the importance of CPR. We all know that it's highly important, but in my years of being certified as a CPR instructor and having the questions that I've been asked in the last 9 years while being an instructor, it is still amazing to me what questions and concerns do come up. So we are just going to do a quick overview today on CPR. There were some new updates released in 2015 with the American Heart Association. So there have been a few things that have changed for those of you that were certified in 2012, 2014, and potentially even if you were certified in 2016, your instructor might have not taken the updated course yet. Because that was not required of all of us until our next certification was due. So again, we're looking at some of the changes. We all know, or we should all know, or what I like to stress to everybody in my classes that I've taught is if you leave with remembering one thing, do remember 30 and 2, and that is the ratio for chest compressions to breaths. Now, the first question I get asked all the time is, well, what about that hands-only CPR that they talk about? And that is only if you are a layman bystander. But if you have been certified in CPR, you are still required to do chest compressions and the breathing. The other thing that they've really focused in on is that if you can be doing CPR within 10 seconds of either witnessing somebody going down or 2, coming up on somebody that is already down and needs CPR, the chances of survival are much greater. And so they've really changed that focus so that way you're not having to do a huge assessment. Basically, you always want to make sure that your scene is safe because you need to be safe in order to do CPR. And then you want to be within 10 seconds acknowledging that this person needs CPR. And then you should be starting those 30 compressions within 10 seconds of arrival. Okay, so if you are just a heart saver, general public with CPR, you do not need to analyze any pulse or worry about what a pulse is or what your pulse rate should be. However, if you are a healthcare provider like myself, within that 10 seconds you would also be analyzing a pulse. But again, just general 30 and 2, you're going to get started right away on that 30 compressions, 2 breaths, 5 cycles, before you would reanalyze them again, and all of that should take less than 2 minutes. So one of the new changes that they've done is it used to be 100 beats per minute used to be your compression rate, which was like the beat to Staying Alive. So Staying Alive, that song, and you could get into that rhythm. But they've actually noticed that if you can increase that rate to 100 to 120 beats per minute, that again, that chance of survival is just slightly higher. So that 30 compressions should take about 15 to 18 seconds. So it's quick, 100 to 120 beats per minute. So that's a new change. The other change that they've really focused in on since the 2015 guidelines is the depth of the chest. So we like to do that at nipple line, and when you're compressing, there is different depths based on adult, child, and infant. But just focusing in on adults, it used to be right at 2 inches was what they were saying, or greater than 2 inches. And now they're saying if you can do 2 to almost 2.5 inches, or 2.4 inches is the exact, again, chances of survival are going to be greater. With children, they are also saying to do now up towards the 2-inch mark, which seems just dramatically deep, but again, if what you're doing you want to be successful, that's what the research is showing. And then in infants, about 1.5 inches, which is again just startling as a parent myself that you would be using that much depth. But so if you have any questions, you can always ask your local instructor, or you can call our Dyersville clinic at 563-875-8615, or I'm in our Manchester clinic and I'd be happy to answer any questions. That phone number is 563-927-1499. You can access our website at ptsiowa.com or our Facebook page or YouTube channel as well. So, thank you.